Can you hear me now? Please say yes. Please say yes. Can you hear me? Hello? Yes. Oh, thank God. I'm so tired. So tired and angry, man. Let's give a few minutes for everybody to be here. You guys should bear with me. Like, I don't know why this night is just so. Honestly, I thought you can hear me now. Okay. Honestly, I almost thought of going to sleep, man, because I just came back and this thing is just happening. I know it's annoying a lot of people. Tell them to come back. Let's discuss bone, even if that's what we are able to accomplish this night. If we can finish bone without any disturbance, then we can. If we have some strength, we can still discuss the muscle. So, I think bone is chapter 7. Okay. Okay, guys. Since all of us are here, let me start this bone very fast. If we can finish bone is very short. Like, I'm not going to be discussing it, so please bear with me. All right. Bone study is osteology. We all know that, and it's a tissue, very special type of tissue. All right. You should know what the cartilage is, the ligaments, the tendons. These are very important stuff that you need to know. Ligaments holds bones together, bone to bone. Tendons, bone to muscle, and cartilage covers every other thing up. Right? It's very important to know. This is the diagram that you should look at. These are the functions of skeleton: support, protection, movement, electrolyte balance, acid-base balance, blood formation. These are the things that the skeleton does for you and me. All right. Now we talk about mineralization. Another word for mineralization is calcification. That's hardening. All right. Individual bones contains all these things. And okay, we have flat bones, usually for protection. Flat bones like the skull. All right. We have the long and the scapula. We have the long bones like the femur, the humerus. Then we have the short bones. All right. Then we have the irregular bones. Short bones are usually the ones you see, all these carpal bones that you see here. Then we have the irregular bones, like the vertebra. All right. So these are examples of these bones. You should look it up later. Now, in terms of features, we have compact, we have spongy. Compact, the strong outer part, spongy, the inner part. Now, if you bring a long bone, we have the diaphysis. That is every other thing. And the ends are known as what? The epiphysis. That end that is big is known as epiphysis. All right. If you look more, you see the articular cartilage, you see the nutrient foramina, you see the periosteum, you see the endosteum. All right. When you look at this diagram, you see all these things. Please go and look it up later. This is the diaphysis. This is epiphysis, epiphysis, epiphysis. This is diaphysis. All right. This hard part is known as the compact. The inside part is known as the spongy. All right. Very important. And if you look at this place, you see a line here. This line is the epiphyseal plate, which is usually where you see the hyaline cartilage that helps and helps for growth. All right. Now, the yellow part is the marrow, the bone marrow. So all these things are the things you need to know. You need to know what the periosteum is. Extremely important for you to know. So take your time and look at the diagram of the long bone, because they can give you a diagram and point to something. All right. The flat bone, an example is the skull. All right. You see, it looks like cheese or like burger. I don't know if it looks like burger, but I just think it looks like burger. Okay, sandwich, not burger. What am I saying? I don't even know the difference between burger and sandwich. Bear with me, I hardly eat all those things. Okay. Yes. Now, one of the most important aspects of bone that you need to know is the bone cells. 4 principal cells. You must know what each of them does. We have the osteogenic, osteoblast, osteocytes, and what? Osteoclasts. Osteogenic, osteoblast, osteocytes, and osteoclasts. Osteogenic cells are what? Stem cells, progenitor cells. All right. They are found in the endosteum. Remember, we have the periosteum and we have the endosteum. All right. Think of this thing now here, this part as the periosteum outside, and think of this part inside as the endosteum. So in this endosteum, that's where you see the osteogenital cells. They arrive from the embryonic mesenchyme. Then we ask you, where does the osteogenic cells arrive from? Embryonic what? Mesenchyme. All right. They multiply continuously, and most of them form what? Osteoblasts. Now let's talk about osteoblast. Blast. You are a blast. Blast, bone forming. Blast, bone forming. Blast, bone forming. Put it in your head. All right. Put it in your head. It's very, very, very important. One, it is not mitotic. It lines the layer of the endosteum and the periosteum. All right. And, it helps to, withhold stress and fractures. All right. And immediately, if there is stress and fracture, the osteogenic cells multiply immediately. You understand? Forming osteoblasts to cover up those particular parts. We call it bone reinforcement and bone rebuilding. All right. Also, remember the osteocalcin is on red because it's something that you can be tested on. This osteocalcin helps to do a lot of things. All right. Despite the fact that they were thinking that it's a structural protein of the brain. All right. But it helps to stimulate insulin secretion of the pancreas. It helps in insulin secretion. Extremely important. So it has a physiological function or physiological role. Now, we've talked about osteoblasts. Guys, osteogenic cells and osteoblasts. Now, let's talk about osteocytes. Now, there are some blasts that, they are trapped in the macula. Anytime you hear sites, just think of trapping. If you hear trapped in the lacuna, pick osteocytes, pick chondrocytes. It has to be a site. The lacuna, right, is just cavities, all right? And the channels to those cavities are called what? Canaliculi, all right? It has gap junctions that allow passages of nutrient and waste signals, and waste and also signals. Now, osteocytes also help in bone reabsorption. We'll discuss that later. So they act as strain. Now let's talk about osteoclast. Osteoclast, cutting down, clast, cutting down. Osteocytes, cut down. If you remember, osteocytes, cut down, always. All right? Yeah, so bone dissolving. Okay. We'll discuss that later. So this is what happens. Look at osteogenic cells here. Same osteogenic cells, that's stem cells. Look at them here. How do osteoblasts form? Osteogenic cells will just turn to osteoblasts. One osteogenic cell turn to osteoblast, and it's when it's this is the lacuna. You see, when it's isolated in the lacuna or trapped in the lacuna, it becomes what? Osteocyte. So osteogenic cells, osteoblast, osteocyte. But osteoclast has its different pathway altogether. All this I hope you can hear me. Let me see. Can they hear me? Yes, you can still hear me. Okay, thank God. We can. All right. So osteoclast cuts down. All right. Let me see what else is important. Thank you, guys. Thank you. You guys are the best. Yes, I need you guys to know that matrix of a bone, right, contains organic matter and inorganic matter. It contains organic matter, which that organic matter is synthesized by osteoblasts, bone forming. What are the organic matters? We have the collagen, carbohydrates, glycosaminoglycans, the proteoglycans, the glycoproteins. And remember glycosaminoglycans, GAGs. Remember GAGs. All right? When you're talking about hyaluronic acid and others, remember it. All right? Now, these are the organic matter. We have the inorganic matter. This inorganic matter, 85% of it is made up of what? Calcium phosphate salt. That's what we call hydroxyapatite. Then we have the 10% calcium carbonate. All right? Yeah. Extremely important that you know this. Now, bone, yes. So another thing you need to know is that that hydroxyapatite, that's the inorganic part. That's inorganic matter. This is the hydroxyapatite. The inorganic matter is what we call the ceramic part. Then we have collagen, which is protein. We call it the polymer part. So the ceramic part and the polymer part. So this hydroxyapatite, that's calcium phosphate and other minerals, form the ceramic part. Now collagen or protein form the polymer part. So it's divided into two: the ceramic part, the protein part. The ceramic part, the protein part. Ceramic parts are made up of all those stuffs, inorganic. The protein part is made up of the organic. All right. Now, if the ceramic part has a problem, why? Because then it causes a serious challenge. It causes a pathology known as what? Rickets. Remember, the ceramic part is the hydroxyapatite for strength. So if the bone, the ceramic part has a problem, the body will start sagging. That's what we call rickets. All right. Now, polymer is the protein parts or the collagen parts. All right. Now, if there's a problem, it leads to something we call osteogenesis imperfecta. You will not be tested on pathology. This is pathology. And remember, anatomy is function. That's normal. Why physiology is function. Anatomy is location rather. Okay, I don't know why I'm saying a lot of different things this night. Bear with me. I'm tired. Okay, guys, you need to look at this diagram very well so that you understand where the nutrient foramen is and also where the canaliculi is. All right, I'm trying to fly. I don't want to waste time here. Spongy bone, you should know spongy bone. I shouldn't be talking about it here. The bone marrow, this bone development. Yes, bone development is also very important. Bone can develop from the intramembranous and from the endochondria. Intramembranous growth and endochondral growth. This is intramembranous growth from the mesenchyme. All right, nothing like hyaline here. But when you're talking about endochondria, what do you start with? Hyaline. You see the difference? This is hyaline. This is the difference. And this is the pattern of growth. So you have to read this pattern of growth because you'll be tested on it. And I'm not going to discuss it. Sorry, I'm trying to be very fast. Okay. So we have now for fetals, children, fetal skeleton, right? Every of its bone produces blood, but it's different from adult skeleton, which I'll show you in a minute. This is metaphysics growth, dwarfism, different types, achondroplastic and pituitary. Okay. Yes, we have something we call appositional growth. Occurs at bone surface. Appositional growth occurs at bone surface. Continual growth in diameter and thickness. All right. That's what we call appositional growth. Then we have bone remodeling. All right. Throughout your life, your bone is remodeling. Very, very important for you to know this. So this is osteoblastic activity, how osteoblasts work. That's what we have here. This is mineral resorption and everything you need to know. All right. So because you'll be tested on it. Now, this is calcium homeostasis. This is where some of your most important questions will be coming out from. Calcium homeostasis. All right. That's deposition of calcium. How many people do we have here? 35. You guys are tired. I'm sorry. I know you're frustrated. I am as well. So we have hypocalcemia and hypercalcemia. You need to know what causes hypocalcemia, what causes hypercalcemia. You see questions, Hypocalcemia, low calcium, deficiency in calcium. All right. But calcium, deficiency in calcium, where? It's not in the bone, but in the blood. When you're talking about deficiency, we're talking about what is happening in the blood. Deficiency in the blood. It can be caused by vitamin D, because the vitamin D helps calcium to be absorbed. It can be caused by loss, direct loss from diarrhea. It can be caused by thyroid tumors or underactive parathyroid hormone. All right. Now, pregnancy is also another thing that could cause it. It's a physiological cause. Then we have hypercalcemia, too much calcium. It's not common. It's not common. It's very rare. All right. Now, for calcium homeostasis, they will ask you what are the things that helps in regulating calcium. These are the things that helps in calcium homeostasis. Let me put it in bold. These are the things that helps in calcium homeostasis: calcitrol, calcitonin, and parathyroid hormone. If you know these three things, you are good to go. Now, let's talk about calcitrol. Calcitrol is the most active form of what? Vitamin D. The processes of its production, you need to go discuss it. All right. From the skin to the kidney, from the skin to the liver, from the liver to the kidney, from the kidney, it does these three things. It becomes mature. It becomes calcitriol. All right. So from vitamin D to from cholecalciferol, from 7-dehydrocholesterol to cholecalciferol, from cholecalciferol to calcidiol. The liver converts it to calcidiol. Then the kidney converts it to calcitriol. They may ask you, what does the liver convert vitamin D to? You have to know. All right. Now, when it converts to calcitriol, it does three things. One, it does bone resorption. Two, it reduces excretion of calcium in the kidney, because calcium can be excreted in the kidney. And three, it helps in absorption of calcium in the intestine, calcium and phosphates. Extremely important. That's the calcitriol. This is the function. All right. You can look it up later if you want. That's the homeostasis. Now let's talk about calcitonin. Calcitonin, they will ask you where is it secreted. It's secreted by the C cells of the thyroid gland when blood calcium levels rise too high. Extremely important that you know this. When blood calcium level rise too high, calcitonin is produced. So calcitonin helps to what? Step it down. It lowers blood calcium. It lowers blood calcium. And how does it lower blood calcium? By inhibiting osteoclastic activity. Remember, osteoclasts, they break down the bone. When they break down the bone, what happens indirectly? It goes into the when bone is broken down, calcium from the bone goes into the blood. So osteoclastic activity increases calcium in the blood. Calcitonin stops the osteoclastic activity. Stops it. Say, stop cutting the bone down. I don't want more calcium. There is enough calcium in the blood. Think. I need you to reason. Don't you know that if you keep cutting the bone down, you are increasing the calcium in the blood? Relax. If calcium in the blood is low, then I can tell you, you can now increase the cutting down so that we increase calcium in the blood. That is exactly the discussion the calcitonin is having with osteoclasts. All right? Okay. I hope you got that. Parathyroid hormone is also very important. It's secreted by the thyroid glands. All right? Parathyroid is PTH, that's phosphate thrashing hormone. What does it do? It thrashes phosphate and it brings in calcium. Simple. It stimulates osteoblasts to secrete rank L. All right, thereby increasing osteoclastic activity. Osteoblasts secrete rank L. All right, this rank L helps to increase osteoclastic activity. All right, promotes bone calcium reabsorption by kidneys by pushing out phosphates. All right, so this is the feedback mechanism you need to know when blood calcium is excess, when blood calcium returns to normal. You need to learn this. This is deficiency. I'm not going to speak too much on it. This phosphate, This is other factors that could help. Please tell me that this is done. This is fracture. No, yeah, this is pathology. I'm not talking about pathology currently, bone disorders, osteoporosis, and this. Okay. I'm so happy that nothing happened because suddenly something will just happen from nowhere. Very annoying. Okay, question time. Are you guys ready? Or you are sleeping? Who is sleeping? Don't sleep on me, all right? This is just 20 minutes. Just sleep on me. Let me see how fast we can. Yes, you guys are ready. You are ready. You are ready for me. You are awake and active. Hold on, let me log in to this. Come on now, this thing, hurry up. Hurry up now. Okay. Perfect. Okay. So we are here. Bone is chapter. Oh God. Just a minute. Is this bone now? See you. Bone tissue, chapter 7. Okay. Okay, here we are. Testing the microphone. Testing the microphone. Everybody should comment. All right, please. I need to be encouraged. I'm sad. First of all, let me remove this thing. Sharing. Yeah. Oh, somebody's sending me some love. Thank you. Thank you. So let's text the microphone. Which of the following tissues is not found as part of the long bone? Options. A. Osseous tissue. B. Nervous tissue. C. Adipose tissue. D. Cartilage. And E. Transitional epithelium. Keep answering. I need everybody to comment, please. If you're not sure, just write not sure or 911 as usual. Okay. 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 It seems everybody's very active. Okay, I love that. Let's test the microphone once more. Transition. Yes, the answer is transitional epithelium. It has nothing to do with this. Where is transitional epithelium found? Have I done the urinary system with you guys? Oh no. This is AP1. I've not. Don't worry. Bladder, yes, bladder, ureter. You're correct. Bladder, you are extremely active. Bladder and ureter. That's the place you see it. You know, like when I was teaching some students about transitional epithelium, somebody was asking me, why is the vagina stratified squamous, non-keratinized, and the bladder is transitional, yet the two of them stretches? You know, and the answer to that thing is because of their function. All right, their function. Stratified epithelium is because of abrasion on the vagina, so that it can withstand abrasion. But transitional epithelium is because we want to avoid what leaking of fluid. It has something we call umbrella cells in it, but that's not what I'm talking about this night. So, which of the following is not a function of the skeleton? I'll give you options. A, storage of the calcium and phosphate ions. That's A. B, storage of red blood cells. C, providing support for most muscles. D, protecting the brain. And E, protecting the spinal cord. A, storage of calcium and calcium. That's the right pronunciation, right? Storage of calcium. Storage of calcium and phosphate ions. B, storage of red blood cells. C, providing support for most muscles. D, protecting the brain. And E, protecting the spinal cord. Guys, let's go. If you don't know it, put not sure, or emergency. Let's hurry up. Let's see if we can run this show in 1 hour. Hurry up, guys. Keep it coming, or keep it going rather. Okay, that's good. You guys are very, very correct. You guys are very, very correct. The answer to that question is storage of red blood cells. It doesn't store. It doesn't store. Instead, it produces a blood, but it doesn't store. Look at this question. The dash is an example of bone as an organ. Dash bone is an example of a bone as a tissue. A, femur spongy. B, spongy femur. C, skull marrow. D, compact sesamoid. And E, red marrow compact. Should I take it again? Okay. I know you are saying yes. No problem. I'll take it again. A, femur spongy. B, spongy femur. C, skull marrow. D, compact sesamoid. E, red marrow compact. Come on, guys. Answer. Let's be fast. We are 37 people here. I expect everybody to be responding. Come on, 1, 2, 3, 4, 5, 6, 7. Only 7 people here. Where is everybody? I thought we were up to 40. Come on, guys. Come on. Let's go. You have to be active, man. All of you need to answer, all right? Oh, yeah. That's nice. The answer is femur spongy. That's A. Femur spongy. Femur is an example of bone as an organ. Spongy is an example of bone as a tissue? Please, look at this question. The cortex of the long bones diaphysis is made of dash. The cortex of the long bones diaphysis is made of dash. A, marrow. B, compact bone. C, spongy bone. D, dense regular connective tissue. And E, articular cartilage. The cortex of long bones diaphysis is made up of dash. A, marrow. B, compact bone. C, spongy bone. D, dense regular connective tissue. E, articular cartilage. Let's go, let's go. Okay, so the answer is compact. It's compact bone, all right? When you're talking about the cortex, you're talking about the outside. So look at this water, you see? You see? So I want you to assume that this outside is the compact. This is the compact. The spongy is the one inside. This outside is the compact, all right? That's what they're asking cortex. Whenever you hear cortex, even when you start doing AP2, cortex is the outside. Cortex is what? The outside. When you, like if you cut a kidney now, the outside is the cortex, like the periphery is the cortex, then the inside is the medulla. Okay, you guys are very correct. Okay, look at this question. These things are testing the microphone. Anyway. The thin layer of slightly denser spongy bone that separates an adult epiphysis from the diaphysis is called the dash. It's called the dash. A, periosteum. B, metaphysis. C, growth plate. D, epiphyseal line. E, diaphyseal line. Let's go, everybody. I'll give you this question, and I'm not giving you the answer, the option. Yes, you guys are extremely correct. I'm going to be very fast now, so you need to be typing faster. Yes, you guys are correct. That thing is the epiphyseal line, all right? The epiphyseal line. Usually that place, what stays there is, yeah, you're correct, D. Usually what stays there is the hyaline, all right? In children, you see hyaline cartilage there, helps for growth. So look at this question. The expanded ends of a long bone are called the dash. I'm not giving you option. Keep going. Correct. You guys are so correct. The answer is what? Epiphysics. Let me see. I just kept quiet. Some people are afraid that I've frozen again. The fear of freezing up is the beginning of wisdom. Okay, look at this. When dash become enclosed in lacuna, they they become cells called dash. I'm not giving you options, and I'm not jinxing it. It has never happened before. Like, I've never had problem with YouTube Live before. It has been smooth ride so far until today. Today gave me a reality check, you know. Maybe because I was in a hurry. Rushed back, jumped to my laptop without even removing my clothes. No. You have to give me two answers in one line, please. When dash become enclosed in lacuna, they become cells called dash. Keep going, guys. Keep going. Somebody said, let me see, osteoblastocytes. Osteoblastocytes. Somebody said osteoclast. Okay. Okay. The class has changed it to sites. I see you. I see what you did there. Okay. I caught you. It's actually yeah. Okay. Okay. Look at this question. Okay, you guys are correct. The answer is what? Osteoblast osteocytes. Eh? Look at this question. Look at this question. The hardness of a bone comes from dash, whereas dash provides some degree of flexibility. I'll give you the options. Let me give you the options, please. Hold on. I'll put it in the box. I forgot I was supposed to give the options. This is A. This is B. This is C. This is D. This is E. The hardness of a bone comes from dash, whereas the dash provides some degrees of flexibility. A, hydroxyapatite and other minerals and proteins. Then B, collagen, elastic fibers and minerals. C, glycoproteins and proteoglycans. D, calcium carbonates, calcium phosphates. And E, proteins and collagen. These people are crazy. Proteins and collagen. Proteins and collagen, what's the difference? Please, they should not kill me with laughter. Somebody saw me and was like, I've lost weight. That's showing on my face. It's not true, right? So this my weight loss therapy is really working. Okay. Yeah, you guys are correct. Yes, you guys are correct. The hydroxyapatite and other minerals. Hydroxyapatite is 85%, all right? And other minerals make up the rest. Then proteins help for flexibility. Okay, you guys are the best. Let me see. Look at this question. Yes, thank God I'm doing this review with you guys because I know many of you would have not seen this kind of question. And I'm so happy that you get to be exposed to it in case of emergency. So look at this question. The plasma membrane of DASH have a ruffled border with many deep infoldings, whereas DASH have long, thin, finger-like cytoplasmic dendrites. You want options? I'll give you options. A. This is A. Testing the microphone is over. Over. This is B. Wow, all these options look alike. This is C. So you have to be extremely careful when you are picking your answers in bone. No wonder you guys are so interested in us having a bone discussion. No wonder. Now I see the reason. Not sure. Yeah, that's fine. The plasma membrane of DASH have a ruffled border with many deep infoldings, whereas DASH have a long, thin, finger-like projections, cytoplasmic dendrites. You know the second one is just two sides, but you know, okay, look at it. The plasma membrane of DASH have a ruffled border with what many deep infoldings. Like it's looking. See my face? That's what it's looking. Just describing ugly. That's what they are describing for you. They are telling you that the plasma membrane is ugly, has ruffled feathers, ruffled border. All right? Something that is ugly, it wants to eat up everything. That is what class. It's cutting down everything. It's angry that it's ugly. It's cutting down everything. That's class. So the first option is class. The second option is what? Osteocytes. So the answer is A. You guys are very correct. Somebody say, oh, okay, now it's coming, eh? Okay, look at this. This one, I'll just read the options for you. It's a very interesting question. Oh no, what did I put there? Control V and it's writing V. Sorry. Which of the following bone cells would have the greatest number of lysosomes? Osteoblast, osteocytes, osteoclasts. Okay, osteoblast, osteoclast, osteocytes, osteogenic cells, stem cells. Which one do you think we have the highest number of lysosomes? Come on, guys, let's go. Osteoblast, osteoclast, osteocytes, osteogenic cells, stem cells. Which one? Which one? Osteoclast. You guys are very correct. Why? The answer is because, not because of the fact that it's cutting bone, no, but because how is it formed? It's formed from different what stem cells. All right. So that's why it has a lot of nucleus and a lot of what lysosomes. Like one cell, we have lysosome. One cell, we have lysosome. Another cell, we have lysosome. So if there are three cells, how many nucleus? Three. How many lysosomes? Three. Check it out. Is that straightforward? Right? Um, Hold on, let me see. Where is this question? Is this particular question? Good. Good. Look at this question. It is common to find dash in compact bone, but they are not seen in spongy bone. A. Lamella. B. Osteoclast. C. Lacuna. D. Central canal. E. Osteocytes. It is common to find dash in compact bone, but they are not seen in spongy bone. A. Lamella. B. Osteoclast. C. Lacuna. D. Central canal. E. Osteocytes. Keep going, guys. Keep going, guys. I need a lot of people to be able to respond. Keep going. What's happening? Are we tired? Are we tired? Somebody's asking me for. Okay. Yes, you are welcome. You are correct. That answer is what? Central canal. Yes, that's central canal. Look at this question, guys, very fast. The space found within the concentric lamella are called dash, and they contain dash. I'll give you the options. A. Canaliculi osteoblasts. B. Osteons stem cells. C. Lacuna osteocytes. D. Lacuna osteoclast. E. Central canal osteocytes. Yes. A. Canaliculi osteoblasts. B. Osteon stem cells. C. Lacuna osteocytes. D. Lacuna osteoclast. And E. Central canals osteocytes. Come on, guys. Come on, guys. Is it that you guys, are you tired? Don't tell me you're tired, though. I have just a few questions to go for this bone. But I need everybody to respond. It's just 6 people. Why? What's happening? You guys are not active today. Yesterday, they were so active. And we stayed yesterday for almost 5 hours. Now, this is just 1 hour. Oh, probably because of what happened. Sorry. Come on, guys. At least 10 people should comment before for me to proceed. 10. I need 10 people to respond to every question. If not, I'm not going nowhere. Okay, they finally woken up. Yes, that answer is correct. It's lacuna osteocytes. It's a giveaway. Look at this question. I hope this thing is not too. Too difficult for you guys. The option is A. This is B. This is C. This is D. This is E. Oh yeah, I need 10 people to respond for us to proceed. 10 people. Intramembranous ossification produces the dash. A. Irregular bones of the vertebra. B. Flat bones of the skull. C. Long bones of the limbs. And D. Short bones of the wrist. And E. Short bones of the ankle. Ten people. 1, 2, 3, 4, 5, 6, 7, 8, 9. One more person. Okay. Somebody says skull. Yes. So the flat bones of the skull, that's intramembranous. All right. Endochondria. The other ones are endochondria. They contain hyaline for growth. This one is specifically the mesenchyme. All right. I even answered this question I want to ask. I already just answered it. Look at this question. So tell me the answer. What's the answer, guys? What's the answer? In endochondral ossification, the precursor connective tissue is dash, which is replaced by bone. In endochondral ossification, the precursor connective tissue is dash, which is replaced by bone. Not sure. If you're not sure, just write not sure. You understand? Because when there is activity, it gives me the energy to continue, guys. You know, you guys are the one that gives me energy. You guys are water. Not only you guys are water. The option: embryonic mesenchyme. B. Fibrous membranes. C. Hyaline cartilage. D. Transitional epithelium. E. Fibrocartilage. It's a 911. Okay. So that's fine. In endochondral ossification, the precursor connective tissue is what? Hyaline cartilage. All right? Hyaline cartilage. It's extremely important that you understand this fact. Extremely important that you understand these facts. If you look at this, if you look at this, yes, you see this intramembranous, all right? You see the mesenchyme laying the foundations. This is the osteoblast, this is osteoid cells, this is blood vessels. So the first thing is deposition of osteoid tissue into embryonic mesenchyme. Deposition of what? Osteoid tissue. You don't hear anywhere where they talk about hyaline in intramembranous. Then from there to calcification of the osteoid tissue and entrapment of what? Osteocytes. So they calcify, they block the road. You understand? Creating a lacuna. And the osteoblast enters inside there, forming what? Osteocytes. Then after that, we have this honeycomb, all right? Look at it. It looks like honey with a comb. Okay, honeycomb of spongy bone with developing periosteum. And the fourth part is filling of space to form the compact bone of the surfaces, leaving spongy bone in the middle. Now look at endochondria. What is the first thing you see in endochondria here? What is it? Hyaline cartilage. Hyaline cartilage, right? From there, you see, this is the primary ossification center. The primary ossification center has to move. It has to move upwards, right? Why? Because of the nutrient foramina has to be created for the blood to pass through it. All right. So it moves upwards to form the secondary ossification center. Then from there, the blood vessels expand. This is the primary bone cavity. Then it expands until it, become an adult bone. All right. I hope you get that. Okay. So honestly, I just want to ask a few questions so that we just be done with the bone. Now look at this. Look at this, guys. The dash is a marginal zone of the epiphyseal plate where in children and adolescents, bone can be seen replacing the hyaline cartilage. A, metaphysis. B, primary ossification center. C, secondary ossification center. D, osteoid tissue. And E, epiphyseal line. Epiphyseal line. Metaphysis, primary ossification center, secondary ossification center, osteoid tissue. What's the answer, guys? I'm looking for that zone. Let me see if there's something else you have to get from it. Because it's looking like there are very important questions from it. I don't know why. Okay. Okay. Seems that there are more very important questions. The first one is zone of reserve cartilage. Second one is zone of cell proliferation. Then we have the zone of hypertrophy, we have the zone of calcification, and we have the zone of bone deposition. Okay. I wanted to see if there is something very important. Okay, so what? Let me see. A. What's A again? Let me see. Yes, metaphysics. You guys are very correct. The answer is metaphysics. Thank you very much. You guys are extremely correct. So very fast. In as much as we are not going to. So look at this. Achondroplastic dwarfism is a hereditary condition in which the long bones of the limbs fail to elongate normally because of the reduced hyperplasia and hypertrophy of cartilage in the dash. A, primary ossification center. B, secondary ossification center. C, primary zone bone marrow. D, secondary bone marrow. E, epiphyseal plate. What's your answer? A, primary ossification center. B, secondary ossification center. D, primary bone marrow. D, secondary bone marrow. And E, epiphyseal plate. Hurry, 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 hurry. I think I'll just ask 5 more questions for this bone. A, primary ossification center. B, secondary ossification center. C, primary bone marrow. D, secondary bone marrow. E, epiphyseal plate. Answer. Not sure, but I guess E. Okay. I like the fact that you tried, you know. Not sure, that's good. Come on, guys, we are up to 40 here. What's slowing you down? The answer is epiphyseal plates, guys. Please, the problem is usually hypertrophy of the cartilage in the epiphyseal plate, because that epiphyseal plate is where the hyaline is deposited. And if that hyaline is not hypertrophied, it will make you grow. All right. So if anything happens to that hyaline cartilage, that person will remain that height. Do you understand? So the problem is hypertrophy of their hyaline. That's even why you as an adult, you see me, you see how tall I am, right? This is my 5 feet. What did I say? 5 feet. This is my 6 feet that I am. All right. It's because my epiphyseal plate stopped somewhere. Somebody say, oh. Yeah. I'm very tall for people that have not seen me before. Okay, look at this particular question. Mature bones remodeled throughout life through a process known as what? A. Intramembranous ossification. B. Endochondral ossification. C. Interstitial growth. D. Appositional growth. E. Metaphysical metaphysical growth. The next thing I will hear, spiritual growth. What's happening? Where is everybody? You guys are sleeping? I should repeat: intramembranous growth, endochondral ossification, intramembranous ossification A, endochondral ossification B, interstitial growth C, appositional growth D, metaphysical growth. Keep answering, keep answering. Keep going, guys. Keep going, keep going, keep going, keep going. Mm-hmm. Yes, the answer is appositional growth. You are very, very correct. Now, look at this question very fast. That zone, because I said there are a lot of questions on zone. I don't know why the question started appearing from zone. Chondrocytes multiply in the zone of dash. Which zone does chondrocytes multiply? Chondrocytes multiply in the zone of dash of the metaphysis. A. Reserve cartilage. B. Cell proliferation. C. Cell hypertrophy. D. Calcification. E. Bone deposition. Answer. Chondrocytes multiply in the zone of dash of the metaphysis. A. Reserve cartilage. B. Cell proliferation. That's B. C. Cell hypertrophy. D. Calcification. E. Bone deposition. Yes, you guys are so correct. The answer is what? Cell proliferation zone. You're so correct. Look at this question, guys. Very fast. A growing, sorry, I'm very fast, all right? Once I get up to 8 people that answers question, I move. A growing long bone in a child has only 2 areas of cartilage at the epiphysis. These 2 areas are the dash. A, let me put the options. This is A. This is B. This is C. This is D. and this is E. A growing long bone in a child has only two areas of cartilage at the epiphysis. These two areas are the elastic cartilage and epiphyseal plates, A, epiphyseal plate and epiphyseal line, B, primary and secondary ossification, C, ossification center, C, fibrocartilage and articular cartilage, D, articular cartilage and epiphyseal plate, E. Come on, guys, let's go. Come on, come on, come on, come on. Let's go. Let's go. Keep going. Please, if you have not subscribed, try to subscribe to this channel, all right? So that when you are doing your AP2, even if I may not be sending you a link, maybe I won't be your professor also, you will be able to know when I'm going live, and you can watch these revisions because you will need them for AP2, all right? Because there are also a lot of videos for AP2, because I know all of you here will definitely pass AP1. I am sure. I am 200% sure. Like, too sure. See how the love is flying in. See how the love is flying in. Somebody's even giving me a pizza. No, now you can't stress yourself like this and you'll not pass. It doesn't make any sense. It's impossible. You understand? Some people think that passing is magic. It's not magic. It's you bringing out your time, studying hard. And all of you are really studying hard, because I know a lot of people are going to work in the morning. A lot of people are going to school in the morning. And you are still here with me, stressing. And some of you here were there on Sunday. And some people that were not there on Sunday has watched almost 5 hours of a video. Come on now. You don't have a choice. You don't have a choice. You have to pass. You must pass this exam. So I will ask you 5 more questions, and that's it for bone. 5. Yeah, so it's by fire by force. So you don't have choice. So yeah, look at this question. The process of dissolving bone and returning its minerals to the bloodstream is known as dash. The process of dissolving bone and returning its minerals to the bloodstream is known as dash. A. No, I'm not giving you. Okay, let me just give you option. Mineralization, mineral deposition, crystallization, resorption, ossification. I know you want the option again. Somebody has said, hey, Nchebe, option again, option again. I'll tell you. Don't worry. I heard you. A. Mineralization. B. Mineral deposition. C. Crystallization. D. Resorption. And E. Ossification. Yes, you guys are very, very correct. The answer is resorption. Wow. I thought you people may not even get that question. I forgot the people I'm dealing with. Okay, let's see. Hold on. It's hypocalcemia. I said 5, right? So this is 1. 5, yes, 5. Yeah, okay. So this is one. Which of the following is not a function of parathyroid hormone? Which of the following is not? A, this, B, this, C, this, D, this, E, this. Oh, you remember PTH? Okay, okay. So when which of the following is not a function of lowers blood calcium? Yes, instead it promotes blood calcium. So the answer is C. You guys are very correct. The answer is C. So that's one. Then this is two. Hold on. Two. The option. Let me give you the options. Growth hormone. So this question, synthesized by the combined action of the skin, kidneys and liver dash promotes bone resorption, but is also necessary for bone deposition. A, growth hormone. B, testosterone. C, estrogen. D, calcitonin. E, calcitriol. Growth hormone, testosterone, estrogen, calcitonin, calcitriol. No, I'm not tricking you. I don't know how to trick. That's why the other time when the volume wasn't functional, somebody said, I thought it was a prank. I said, why will I be pranking? Jesus Christ. If you know how tired I am, you see that I don't even have time for pranking. No, I don't do prank. Nah, not my thing. I really don't like people doing prank on people. You know, I heard a story of somebody that they did prank on and the man died. They don't know that the man is a hypertensive patient. He said, I need sleep. Yeah, I do. I actually do. Funny enough, I won't. Because if I finish, I have to set the exam for my students. And before I finish, it takes me a lot of time. He said that escalated quickly. Yeah. So the answer is calcitriol. How many remaining, guys? How many remaining? I need to choose my questions carefully. Three. Perfect. That's big enough. One. If a thyroid tumor, okay, no, let me put the answers. Relax. Let me put the answers, guys. Let me put the answers. A, B, C. D. E. If a thyroid tumor secreted an excess amount of calcitonin, we would expect an elevated level of osteoclast activity, an elevated level of osteoblast activity, a reduced rate of endochondrial ossification, a rise in blood calcium concentration, and increasingly brittle bone. What was the answer? What was the answer, guys? He said, oh, wait. Sure. I'm always very patient. If a tumor, a thyroid tumor, it's usually medullary carcinoma, right? Yeah, something like that. What is your answer? Yeah, medullary thyroid carcinoma, MTC. So if a thyroid tumor secreted an excessive amount of calcitonin, we would expect what? If you are not, okay, sure. What I will do now is to... Okay. So let's go to calcitonin, because I really need you guys to be answering these questions with confidence. Look at calcitonin. What does calcitonin do? Calcitonin is secreted by C cells, right, of the thyroid gland when blood calcium level is too high. So if blood calcium level is too high, calcitonin is produced. What does it do? It lowers blood calcium concentration by doing what? Inhibiting osteoclasts, thereby reducing bone resorption. It inhibits this guy, so thereby reducing bone breakdown. What does it stimulate? It stimulates osteoblasts to deposit calcium. So if I am producing if you have a hormone that is producing too much calcitonin, don't you think it will keep stimulating this guy, osteoblast? So it's osteoblastic activity. That's how I need you to see it. And you understand? So look at it. If a thyroid tumor secretes an excess amount of calcitonin, we would expect what? An elevated level of what? Osteoblastic what? Activity. Are we good? I hope this explanation makes sense, guys. Yes, I believe. So that you won't be, I don't want you to be. Okay. Yeah. So I want you to be answering this question with confidence. So how many to go? 2 more, right? Okay. Second to the last. Okay. Second to the last. The result of blood calcium and phosphate levels being too low for normal deposition is a softness of the bone. What am I even reading? Jesus. The result of blood calcium and phosphate levels being too low for normal deposition is a softness of the bones called dash in children and dash in adults. A. Osteomalacia rickets. B. Rickets osteomalacia. C. Osteoporosis osteomalacia. D. Osteomyelitis osteosarcoma. E. Osteomyelitis osteomalacia. Osteomalacia rickets, that's A. Rickets osteomalacia, B. Osteoporosis osteomalacia, C. Osteomyelitis osteosarcoma, D. Osteomyelitis osteomalacia, E. You guys are so correct. You are very, very correct. The answer is what? Rickets osteomalacia. Rickets in children, osteomalacia in adults. All right. My last question. Give me a minute. Okay, look at this. Yes. Appositional bone growth is a process that dash A. Incoming. He says he's looking at models. B. C. D. E. So that's it. Appositional bone growth is a process that dash A replaces older bone with a new bone, B forms new bone from fibrocartilage, C eliminates blood vessels from bone, D reduces the number of osteons, and E forms new bones on the surface of older bones. Interesting question. Why am I seeing this thing on the screen? Is it like at 5? Please, people should increase it. Increase it to like 20. Keep pressing like. I play too much. I think so. Oh, this last question is now shaking you guys. Keep increasing it. It's 9 now. Make it 20. But as you're increasing it, make sure you are getting the answer as you're increasing it too. I like this my headset too. I think I'll be using it now. And I had it since. It's a 20 likes. What is happening? That question is so difficult. Appositional growth. Guys, appositional growth is when new bone form on top of old bone. Chicken, huh? The answer is E. Forms new bone on the surface of older bones. That is it. You have to know it. Put it to your head right now because, it's possibility. You understand? Sometimes we reserve the best for the last. All right? So that is how we come to the end of bone revision. All right? The muscle is very straightforward. You will know muscle, I believe. Then I have a muscle video. Please go watch it. Go and watch it. Go and watch it. I have a cell video. Go and watch it. I have a macromolecule video. Go and watch it. I have a genetics video. Go and watch it. All right? Or better still, just go to the review yesterday and listen to it as if you are part of it. Answer the questions. You pause, you answer, it moves. You pause, it answer, it moves. All right? And if you have any question, always leave comments. All right? Come back, make comments. All these revisions, you still need them because we will use it for you use it for your finals. Extremely important. We will still do a marathon review then, but use this for your finals. All right. So for people that will be with me, you'll be answering all at least 100 questions. So try to look at everything. All right, and be ready. Your question will not be out of world question. No, it will be something you already know. It will be things that we keep touching and touching and touching and touching and touching. All right, and I'm 101% that confident that you guys, bringing out your time to be with me this night, you guys will pass very well tomorrow. So I wish you success tomorrow in your individual class. All right. try to subscribe to the channel. Try to subscribe so that I'm on your notification. You need to on notification so that whenever I go live, even if I don't remember to post it or I do not post it for your own class, you'll be able to see it and know if you want to join or not. Thank you. We spent 1 hour 25 minutes. That's good. That's good. That's the shortest I've ever stayed. Thank you. On live, it's always 4 hours, 3 hours, 5 hours. Even if I want to die, they will not know. Okay, so you guys have a wonderful night. Sleep well. Or is there any other thing you want me to explain? Any other chapter you want me to shed a light on? Please say no. Please say no. Please say no. He said, thank you, Dimples. Honestly, I used to have one dimple, unilateral dimple. No, thank you. Thank you. I love you too. I used to have unilateral dimple that year, but it's not showing because I was so fat. Now that I'm losing, don't worry, I'll lose weight. Before I finish with your class, I'm going to drop from 190. I'm 190. Today, I was 191 or 192. Thereabout. I'm going to drop, before I finish with you guys, I'm going to drop to 175. You understand? So this dimple will show very well. It will go deep, like real deep. It used to be extremely deep that year. Yes, I did. You remember when we started, I told you I was like 220. You see me, I was so clumsy then. But look at me now, very, very sharp. I would have lost more weight. Just this my leg that is disturbing me. This my knee. So it's not allowing me to do exercise. I'm no longer running. I'm no longer playing soccer. Until it heals. If it will, anyway. So I have to. Yeah, I have to. He said that's too skinny. No, it's not true. Even if I lose weight now, you will not know. The problem is that my weight does not show on my body. That's just the problem. It doesn't show on my body. I was 220 and people look at me and they will never believe that I'm 220 pounds. He said we will know. Oh yeah, go and sleep. Go and sleep. It will show your face. Really? Maybe. I don't know. Okay, go and sleep, please. Go and rest. Don't read anything this night. Don't. Just sleep. Wake up in the morning, watch the videos. You say I'm gisting. You know me now. If I start with the gist here, I can gist too. I like to gist. Sometimes I'll call, some of my friends and you see me talking for 2 hours. I gist. I don't play with gisting. It's live. Amiibo. That's what we call it in Nigeria. Amiibo. Okay, guys. I'm waiting for you people to go so that I can go off. Somebody told me that it's rude for me to go off before my subscribers. Okay, finally they've started going off. He said we have trust issues. Oh, God. Okay, you think if you go off, I will start teaching again? Hey, Jehovah. Oh my God. Am I sneaking a question? I'm not sneaking anything. I want to set the question for my students, my class people. Hey God, you guys are so funny, man. It's interesting. It's fun. He said, "Oh, yeah, be going." Okay. Good night, guys. Good night. I'm going to go off now. I'm ending stream. Good night. Have a nice night. It was nice doing business with you.